Hi there. In this module, we are going to unpack what inclusive in citywide inclusive sanitation means. We will understand the conceptual differences between equity, equality, and justice in the context of water and sanitation. Then we can zoom specifically into the aspects of gender and disability. Finally, we can understand how to plan for equitable sanitation services. The I in CWIS stands for inclusion. This could mean a variety of different things, such as 1. Considering various centralized and decentralized technologies, whether it is FSM, container-based sanitation, small-scale sanitation systems, or sewers leading to centralized STPs. 2. Equity for communities marginalized by gender, age, disabilities, religion, caste, or income levels. 3. Planning with the involvement of all stakeholders: government, community of users, private service providers, sanitation workers, academia, and funders. 4. Consideration of the entire value chain, from collection, containment, conveyance, treatment, reuse, and disposal. And finally, taking into account of the larger urban development goals, including water supply, stormwater systems, solid waste management, slum development, and environmental protection. In this module, we will focus on the aspects of equity for marginalized communities, especially gender and disabilities. Let us first understand what equity means. It is often confused with the concept of equality. Therefore, it is important to understand the difference between equity, equality, and also justice. Equality is when everyone gets the same level of support. This might leave some people behind. Equity is when everyone gets the appropriate support that they need. This allows everyone to have access to the facilities. Justice is when the systemic barrier itself is removed. While providing sanitation services, special attention must be given to different communities which are often marginalized. They could be disadvantaged by gender, disability, age, income levels, or even caste in certain situations. Now let us look at gender and disability in greater detail. Gender matters in sanitation. The biological, social, cultural needs differ hugely between men and women, right from menstrual hygiene and pregnancy to childcare and privacy. Women are disproportionately impacted by the day-to-day burden of water and sanitation-related tasks. Yet, women are underrepresented in policy framing and decision-making. Even in studies related to sanitation and toilet standards are often based on male subjects, leading to unfriendly designs for women. The location of community or shared sanitation facilities can impact the risks of both physical and emotional violence. At schools, sanitation is a big reason for girls to drop out, which then impacts their health, independence, and productivity. However, it is possible to make sanitation equitable for women. For this, the first step is to acknowledge that gender dynamics and power relations play a role in sanitation. Studies show that when women have increased decision-making power, the household spends more on health, education, and well-being. This in turn improves children's, and particularly girls' education, health, and nutrition. Making sanitation equitable could take various forms. Whether it is making female-friendly she toilets available in public spaces in cities, like here in Hyderabad in India, or meaningfully including women in the different stages of planning and deciding sanitation interventions, like here in South Sudan. Sanitation loans through women self-help groups are yet another way which gives an opportunity for women to directly invest in sanitation solutions that meet their needs. Now, let us look at how disability-related inequity is prevalent in sanitation. More than 1 billion people in the world have some form of disability, and these rates are much higher in low-income countries. This section of the population is more vulnerable to having inadequate access to water and sanitation services. Studies from low and middle income countries indicate that 1 in 7 people with disabilities find toilets at home inaccessible. Even in developed countries, a large number of public toilets are not wheelchair friendly. However, experience suggests that disability inclusive interventions increase the total cost by less than 3% from the cost of regular latrines. In order to achieve universal access to sanitation, there needs to be special attention provided to the members with disability. These could be done through simple changes such as step-free access, sturdy support in latrines and hand-washing facilities. Affordable innovations such as this assistive latrine for children with disabilities make a significant impact on their access to safe sanitation. This is possible only through inclusive planning and policies towards creating disability-inclusive development. An overarching community for whom equity needs to be operationalized is the low-income communities or the urban poor. Most countries across the world resort to subsidies to ensure equitable access to water and sanitation services. Subsidies are financial instruments that allow users to pay less for a product or service while the rest of the cost is covered by the government or future generations. A recent report from the World Bank reveals that the largest part, which is 56% of these subsidies, go to the wealthiest quintile, while only 6% reach the poorest quintile of the country's population. The urban poor often end up subsidizing the cost of sewers for the rich who avail sewer-based sanitation services. And in a double blow, the poor also pay a much higher fee for emptying their fecal sludge or for using communal toilets. Since in most countries, the sanitation fee is collected as part of the water tax, the poor also pay for services that they don't necessarily receive. That is why the urban sanitation situation across most countries is the same. The poorest quintile is much worse than the richest quintile within the same country. This is exactly what needs to change. While sanitation services are planned, the process must be comprehensive. This means that various stakeholder groups are involved in the process and special attention is given to the needs of marginalized and vulnerable communities. This is made possible only when inclusive and equitable targets are placed. In summary, we have learned what inclusion means in the context of CWIS. We have understood the difference between equity, equality, and justice. And we had a closer look at gender and disability-based equity. When subsidies are ineffectively targeted, the poor bear the brunt, leading to further inequities in sanitation. Ultimately, to achieve equitable sanitation, comprehensive planning through the involvement of various stakeholder groups is key. Here are some resources that can help provide a more detailed perspective on equity and inclusion in sanitation.